Okay. Hi, everyone. Oh, it's so lovely to be here with all of you. Selfishly, I also have been learning a lot and really enjoying all the things that I can go back and apply to my business. So I'm very grateful to all of you and amazingly fortunate to be here as part of this event. So a little bit of background before I get started. I came up through the industry, so I started in front of house management and thought I was going to work in restaurants for maybe 2 years, and here I am, still in restaurants. And I was laid off from my in-house HR job in late 2016. And as I was interviewing, I started to realize how many small restaurant groups need HR support. But that traditional in-house HR model just does not work. And I'm sure that a lot of you feel this. So that's why I started Empowered. And we offer HR consulting services to restaurants specifically, and many of us are from restaurants. So the first thing I'll say is I have been where you are. I am a business owner. I also have worked my whole career in the industry, so I understand that a lot of what pertains to employee benefits in our industry is very broken. So my goal today is to give you some hopefully actionable and very practical information about what's out there for benefits in healthcare so that you can go back and bring something to your teams. I am also going to try to save more than 15 minutes for your questions, anything from HR, benefits, so feel free to start brainstorming. So some things that you should know if you're thinking about benefits for your team. How many of you are actively exploring benefits that you can offer to your employees? That's amazing, so most of you. So the first thing you should know is you're ahead of the curve, which is great. And I'll talk a little bit about the context in our industry and kind of where you can place yourself, even as a small entrepreneur, by starting to think about benefits and employee welfare. Second, benefits are more than health insurance. There's a whole world of benefits that are out there that you may want to think about. Many of them are free, so that's the good news. Your employees may not value what you think. I think one of the amazing takeaways for me from the earlier panels was the amazing creative ways that a lot of you are supporting your teams. And again, they're not necessarily through traditional benefits, which are incredibly expensive. Health benefits don't have to be expensive, so there are ways that you can creatively offer medical and other types of health-oriented support to your employees that do not involve paying $500 a month for health insurance. And then also, I want to spend some time thinking about how to get started. So if you are thinking about benefits for your employees, you are ahead of the curve. So I don't have to tell you that competition for talent is at an all-time high. The gap between open jobs and available work has massively increased, particularly during the pandemic, but as someone who came up through the industry, I know that it has always been an issue in hospitality. From February 2020 to today, the gap in jobs in hospitality increased 8%, which is the equivalent of about a million jobs, a million jobs, which is terrifying if your vocation is finding people for your clients, as you can imagine. Reasons that people are leaving hospitality. These are some of the commonly cited reasons that people are leaving, and many are not coming back. Low wages, challenging hours, the emotional labor, which all of us feel, of catering to others who are not always kind, especially during a pandemic, health and safety, and then poor management. So these are obviously some pretty big issues we've heard talked about quite a bit today. But one of the things I find interesting is only 30% of restaurants offer health benefits. I find this actually pretty shocking for the amount that we talk about it. We talk about it a lot, and our employees talk about it a lot. So my guess is here, and I would love to see a show of hands, how many of you are required to offer health insurance under the Affordable Care Act? How many of you do not know if you are or are not? Thank you for being brave. So there is a threshold of 50 full-time equivalent employees where you're actually required to provide health insurance. But what does that mean for smaller businesses? It means that the people you're competing against to hire quality talent are generally offering insurance to their employees because they're obligated to. So how can we think creatively in a way that works for smaller businesses where you can actually incentivize employees to join you and stay? So the first thing I wanted to make a point of is that benefits are much more than health insurance. And in the world of HR, we talk about total rewards. And here are some examples. This is not exhaustive, but you have things like competitive base pay, performance-based compensation incentives, recognition, paid time off. Again, a lot of the benefits that we heard some of the earlier panels talk about. So what does this mean? This means that you have a smorgasbord of different benefits to choose from, not all of which are expensive. So that's the good news. There's one I didn't list here, and a light bulb went off earlier today that financial education is also an amazing benefit. And again, a lot of these are free. So I'm happy to go into greater depth on any of these. So just keep in mind if you have questions about any of these specific areas. Okay, more importantly even than what benefits are available is the fact that your employees may not value what you think they value. So this came from a survey that was done by Harry, which is an employee scheduling program of about 1,700 employees in hospitality. And what I find incredibly interesting here is where are benefits? Benefits are all the way down at the less important category. And what are the things that matter to employees? Having a reliable, predictable schedule. Feeling part of the team. Those two things are free, by the way. Then earning money, yes. Having direct access to tools and training resources, again, can be free. Working hours, also free. Career growth opportunities, also free. So you can kind of go down this list, but I think what's important here is understanding we're going to talk about traditional benefits and what you can do, but a lot of what keeps your employees engaged and happy has nothing to do with a benefit that you're buying for them. So that to me is really important and promising, right, for small businesses. Finally, health benefits don't have to be expensive. This is probably the money slide, no pun intended, for those of you who are thinking about health benefits. You do not have to offer an incredibly expensive medical, dental, and vision plan to achieve the support that your employees need. So let's talk about some of these options. A MEC plan. So some of these, for how many of you are these not new concepts? I'm just curious. Okay, so there's some new information here for some of you, hopefully. So a MEC plan stands for Minimum Essential Coverage. This is a plan that essentially checks the box for the Affordable Care Act. It is not a good insurance plan. It is for you as the employer to cover your obligation. What I like about this is the flexibility that it offers. So you can put a plan like this in place to, again, cover your employees for your requirement to provide health insurance, and it frees you up to invest in other things that your employees might value more. So if you're above that 50 full-time employee threshold, something to think about. It's an alternative. Brokers don't want to tell you about this because they're not going to make a lot of money off of it. The second is FSA, HSA, HRA. So this is very confusing, right? HSAs specifically are very interesting and compelling benefits that you may want to think about offering. The reason being that if you offer a high deductible health plan, and Jody mentioned that she, over many years built up to the point of offering a very robust zero deductible health plan, which is incredible and an amazing achievement. If you can't do that, most brokers will steer you towards a high deductible plan. That plan obviously has a huge gap between which an employee enrolls and when they actually start seeing any kind of benefit from participating, because they're paying out of pocket until they reach that deductible, generally. What an HSA can do, or an FSA or HRA, is it basically gives them pre-tax dollars to spend on medical expenses. What is especially interesting about an HSA, though, is it's also an investment vehicle. So for those of you who are thinking about retirement, you can actually set up an HSA and you can contribute up to $3,250 a year, which rolls from year to year to year, and you can invest it just like your IRA. So not a lot of people know that. You don't have to spend what's in the HSA. You can keep it and hold on to it. You can also contribute to it for your employees. So it's an amazing benefit, especially if you offer a high deductible health plan. Incidental insurances, things like cancer care, things like accident indemnity, there are a whole bunch of additional kind of fringe insurances that you can offer to your employees if they get admitted to the hospital, for example, unexpectedly, or if they get cancer unexpectedly. These are insurances that can help cover them in the most catastrophic occurrences in their lives. Again, maybe a great option if having a very robust health insurance plan is not an option for you. Employee assistance program. So employee assistance programs basically provide a variety of different benefits, things like lifestyle discounts, clinical counseling. Usually there's a library of educational resources. This is probably the most frequently picked up by our clients right now. And this, to me, is a fairly low-cost way to provide mental health and counseling resources to your employees. I'll provide a very personal and kind of recent example. We had a client who had an employee, a guest who passed away at the restaurant. Right, and this was a very traumatic occurrence. It was something that multiple employees witnessed. So, I mean, how many of you would know what to do in that situation? I've been in HR for 10 years, and I did not know what to do. And so what was great about the employee assistance program is we called them and said, hey, how can we support our employees? And they said, we're going to have a counselor on site tomorrow to meet with the employees who were impacted. We can give them 3 free counseling sessions. Then we can sign them up for more counseling that's paid for by their insurance. So it's amazing to have, again, kind of a support like that. There are prescription savings programs. So those are programs that help reduce the cost of prescriptions. So about 50% of the US population has at least one prescription that they order each month. So the benefit of a program like this is it helps reduce the overall costs, by the way, which have increased about 60% over the past 5 years. So it is only getting more expensive, but a lot of us need prescriptions to live well. And then also a wellness stipend. So you could offer a stipend for people to get their own support, right, as opposed to telling them what to use it for. So it's something to think about. What employees want, in my opinion, these days is flexibility to choose something that works for them. So it's not having a traditional kind of singular old school benefit program. It's having something that they can really tailor to themselves and their own personal needs. So how do you get started? This is really where it gets pretty overwhelming, even for myself, right? Having built a career in HR, how do we start? How do we figure out what we're going to offer first? So I always like to start with your employees. So how are you understanding what matters to them? We like to use things like pulse surveys to understand what your employees feel are the most important benefits to them It may not, again, be something traditional. It might be something like, I want PTO, for example. It might be something like, I'm struggling with childcare and need help with options. So really understand what they need and then prioritize it. And I would think about it in kind of 3 different ways, right? Think about impact. So what will the impact be to your employees? Think about cost and think about effort. How much effort will it take for you to implement that solution? And then you kind of come up with your prioritized list and you can phase out which benefits you're implementing. I think sometimes when you think about all of them at once, it gets a little bit overwhelming. So one of the things I really like to do is let's break it into phases. Let's get the higher impact, lower cost items implemented first. Let's let those marinate and see what the uptake of those programs is like. Historically, and this was mentioned earlier too, historically, benefit enrollment is fairly low among hospitality employees, especially traditional benefits. Medical tends to be around 10 to 15%. So what do we know about that? It's probably about communication and education. So if you're implementing a benefit, give it time. Give it time, put effort into how you communicate it. It's really easy to implement benefits, relatively speaking. It's much harder to get your employees to actually be interested in them. So I think moving slowly and really dedicating yourself to communicating this effectively is incredibly important. Measure, learn, and adjust. So once you see what kind of engagement you're getting from your benefits, measure how your employees feel about it. Learn from them what you can do more effectively to communicate it. Learn from them what other benefits now they're starting to think about. And that constant cycle of implementation and then kind of evaluating how people feel about the programs you're offering is really incredibly important. Where can I get more information? Okay, so there are several people who can help you through this process. There are benefit brokers. Benefit brokers are biased, so be careful. There are, HR professionals who specialize in this. There are your colleagues, and I think that is probably your best resource, being here in a room of amazing entrepreneurs who have all kind of been there and done that. Talk to each other about what you're offering and what's working. Not everyone is going to be able to offer, 100% coverage on a zero deductible health plan, but there's someone here who has a business like yours and probably has found something that works. So I think that also is a really great suggestion. So that was really meant as just a very high-level overview of what is out there in the world of benefits and how can you go about navigating those decisions. But I would love to actually save quite a bit of time for questions about anything HR related, anything benefits related, or also just to tell me what you need in the way of support also. We're constantly trying to learn and improve our business and how we support the restaurants we work with. So I'm really interested to hear what your challenges are also.
So with HR, you guys also deal with payroll too, correct?
Yes.
So out of curiosity, because there's been this huge uproar with Salt Bay's service charges, and out of curiosity, because we started implementing our service charges too, when you guys do the implementation for service charge into wage, do you guys have to calculate that overtime pay in the service charge?
So you're talking about how you're distributing service charges that you've collected as a business?
Yes. So for example, in Nevada, we have a daily overtime rate, which is, anything over 8 hours in a 24-hour period. Mm-hmm. But if you are exempt from that because of the service charge, if somebody was to go over 40 hours per the week, the service charge calculates into their overtime rule.
Yeah, so I will attempt to answer that. I think and I'm happy to talk after also. So if we were to approach that in New York, and I'll just speak for, our kind of core group of clients in New York, when you build in any kind of gratuity to a base hourly wage, you have to factor that into your overtime calculation. So we're not actually permitted to do that in New York, but theoretically what would happen is you would distribute the service charges through some kind of bonus or one-time payment on payroll, and then you would have to factor that into overtime. I hope that answered your question.
I have a quick question. So as you had mentioned that the typical HR isn't really in-house, isn't very commonplace for restaurants. It's usually the owner who is doing all of the human resources. And then as we grow, it seems that we pass it on to somebody to do, and that tends to be our general managers, was what I'm doing and what I know a lot of other people are as well doing. But again, that goes to hiring somebody who is good at maybe a front of house job to manage HR now. And then I wonder, in continuing training, do you have any resources of where they could learn basic HR, have a training versus us trying to train them to be HR managers?
Yeah, definitely. That's a great question because I would guess that's the situation most of you are in. So there are some great resources out there in terms of SHRM, which is the Society of Human Resources Management. That's a national group that offers certifications, and it has a great portal that has a lot of free information, policy templates, things like that. I'll speak personally, when I started in HR, I didn't have any formal background either. So I had to learn everything myself. So I did a lot of following law firms that specialized in employment law, getting their updates, joining webinars. That's a really great free source for information. And certainly following other kind of HR related websites, right? So there are other companies, even payroll companies that offer HR support you can follow for information. And I also, obviously I'm biased, but like part of my belief in our business is that you should really have a hands-on support from someone who does know. So whether that's, again, your employment attorney or an HR consultant or an HR person who you're friends with and you can pick their brain, I think getting that information firsthand when you need it is also really important, right? You have an employee who files a sexual harassment claim, you're not gonna go like research, how do I resolve this? It's much easier for you to call someone and say, okay, what would you do in this situation? So those are kind of three places that I would look for support.
Kimberly at the back. Kimberly's at the back. Oh no.
Hi, I have a question for you. So I've been on the health benefits journey for my team for about a year. I'm fortunate enough that I get my health care through my husband. He works for Lockheed Martin. It's a massive organization. I have incredible health care, and it doesn't cost us the same. Economies of scale for small businesses don't kick in, right? You don't get that benefit, that max, beautiful plan, that Cadillac of health care with 20, 25 employees. So as I've been shopping this around and talking to different brokers, I recently decided to, let me just focus on 401k because that's easy to get that out of the way. And it doesn't make sense to give them keys to a car if they don't know how to drive it. So I hired a financial planner who essentially is teaching them financial literacy. He brought up during the conversation that I should look into a PEO. What are your thoughts on that?
Yeah, I'm glad you asked that. I figured someone would ask the PEO question. So PEO is a professional employer organization, and basically what that means is they co-employ your employees with you. So something like an ADP or a Paychex, they basically offer an option where you enroll your employees in a group of other businesses and share in that insurance and share in that, it'll be workers' comp, it'll be medical, dental, vision benefits, it'll be retirement benefits. So I have mixed feelings about PEOs. I think it depends what you're looking to get out of it. Because hospitality employees have traditionally pretty low participation in benefits, and as a member of a PEO, you pay a monthly per employee cost, you really have to crunch the numbers to see if it's going to make sense, right? If you work with a PEO and you don't have the uptake on the insurance programs and things that they offer, you know, it can be kind of cost prohibitive to do that. I think personally going the more traditional route and just having your payroll, your benefits, and kind of managing all separately from a financial perspective makes more sense. But again, with a PEO, the benefit is they've done all the legwork for you. So they've gone out, they've found the benefits, they found the retirement plan, and you're basically paying a premium in order to participate in that. And to your question about Lockheed Martin's benefits, which is amazing, you know, the benefit of a PEO is you're participating in a large group as opposed to a small group. So most small group plans are kind of off-the-shelf solutions. There's really not room for negotiation. With a large group, you have more flexibility to kind of custom build the plan that you end up using. Again, with a PEO, you're not really custom building it, you're kind of just accessing the plan that they've custom built for you. So you don't have a ton of flexibility, but again, it may make sense. The punchline of all of this is there is really not one-size-fits-all solution, but for PEO, I would look at, you know, what do you expect your engagement to be in the plans? And if it's 10 to 15%, you know, does it make sense financially to pay $100 per employee per month to, you know, not have employees take advantage of the benefits that are offered? So that's kind of the analysis that I would go through.
I have a question. I pre-got the mic. I wanted to use your advice of using this wonderful network and ask if anybody has an EAP that they offer and they like, or if you have a suggestion of a company to go to for an EAP.
Well, we've done a bit of research into the different options that are out there. The first thing I would say is some of them are geared towards larger businesses versus smaller. So if you are researching, I would first pay attention to if they have any minimum headcount requirements. The one that we use with a lot of our clients is called the EAP, so it's easy to remember. And they, again, have very robust benefits. They came recommended to me from the HR director of Union Square Hospitality Group, right? So you know that it's been kind of tried and true for them. So I would recommend that one, but does anyone else have recommendations? Well, it's a good thing to research if you have not looked into it yet. And the way that their fees work also is it's usually just an annual fee, couple $1,000s a year, so it is an investment. But you get a lot of benefits that come with that, especially when employees are going through some kind of personal crisis. It's really helpful because you don't want to be responsible for that as a business owner, kind of providing support in a situation that you don't fully know how to handle. So the other thing I'll mention too is a lot of cities or states have great free resources. So like in New York City, we have a website called NYC WEL. It's a mental wellness hotline. It's completely free. I have called it in the past when I had an employee situation, you know, someone dealing with a mental health issue, and I didn't know how to handle it. So I would also look to your city or state governments to see what, if anything, they provide. The EAP, yeah. Oh, no, the as in THE. The EAP. Yeah.
Hi, I had a question. Looking at like resources to do research around sexual harassment issues. I'm a new restaurant owner, and I have never had to deal with as much sexual harassment in the last 6 months that I've had to deal with in 30 years of being in this business. And so it's just interesting, just trying to find support around it. And in the moment, it doesn't, it's just like you're all on your own, and I want to be a bit more prepared than the last couple of days. And just was wondering if you could point toward more resources.
Yeah, definitely. Well, I can point to, again, some New York specific resources. But New York was one of the first states to implement required sexual harassment training, so they have a really robust set of resources. So if you go to, in New York, it's called the Stop Sexual Harassment Act. You can go to the website and find things like template policies. They have an online training that you and your employees can take. They have a complaint handling guide. So they really kind of break it down for you very specifically, and I think it would be helpful to any of you, even if you're not New York City based. And then the other thing I would also suggest is, look to the businesses you already work with. So if you have an insurance carrier who you work with for EPLI insurance, which is Employment Practices Liability Insurance, you should all have that. If you don't, it protects. Oh, yes. So EPLI insurance protects against discrimination and harassment claims, so any EEO-related claims. And what it will do is it will pay for your legal fees. Sometimes it will also cover any kind of settlements or damages that you're paying. And the reason this is really important is, and we see it a lot with our clients, you all mean well. You all try really hard to take care of your teams. And sometimes in spite of that, things will happen that make people uncomfortable. Sometimes also people come into a business with bad intentions. I've seen that happen once or twice. So it's really important to have that fallback because our industry has the highest number of EEO-related claims of any industry in the country. So, this is a very real threat to all of your businesses. I hate to use scare tactics, but it's real. So, what I was saying about the EPLI carrier is they will often have resources that you could take advantage of, like, again, anti-harassment training or policies or templates. And I would also look at your payroll company. They may also have something like that. So, again, there are a lot of kind of great resources that you probably have at your fingertips. It's just a matter of asking some of the third-party businesses that you already work with. Yeah.
We talked this morning about mental health, and do you know of anything that's, maybe it's just that employee assistance program, but something that would be a resource outside of health insurance, like even if maybe a plan offers, mental health counseling or therapy, but if people don't have the insurance or the plan doesn't offer it, where there's like just that element, or are counselors that do just that for hospitality?
Yeah, well, it's a good question about the counselors, right? And I can just say from personal experience, I don't know of any kind of go-to human counselors, but what I will say is some businesses are also starting to use those mental health apps. So they might offer a subscription to one of those apps, mindfulness apps or therapy apps that people could talk to confidentially. I also think that it's a problem in our industry that we don't have better support in this area, right? So I'm not going to say there's a solution when there isn't one. I think what I have seen is it's easy to kind of piecemeal some kind of solution from the different options out there, whether that's a free hotline, it's an app, it's an EAP, but I haven't seen a company that does it really comprehensively as of yet. But I think it's a very ripe opportunity for a business to come in and really make an impact, and also obviously an area that needs a lot of support in our industry. Yeah. Yeah, you mean if you're basically taking responsibility for getting them support and then they leave and they're not getting that support anymore. Is that kind of what you're talking about? Yeah, it could be. I think, You know, there definitely was historically a stigma around getting involved in your employees' personal lives, right? I remember being a manager and having an employee come to me because they were dealing with abuse at home and they didn't know what to do, and I didn't know what to do. And, you know, at the time, the idea was support them in a way that you can, but you really shouldn't get that involved. And I think that whole mentality has actually shifted since the pandemic, where being involved and supportive to our employees in their personal lives, like there's more of an imperative around that now. So I think those old boundaries have actually kind of gone away in a sense that it's, I would say, reflects more poorly on a business to not attempt to offer some kind of support. Don't do it yourself. Like if that's not your area of expertise, don't try to offer mental wellness support to your employees, but you know, bring solutions to them because they look to you as someone who knows better. They look to you as someone who has resources as a business owner, and I think that responsibility is very real and very kind of current. So, you know, I think to answer, like, yes, it may be a bit problematic, yes, but like humans are messy, and personally I feel like offering the support and having it be a little bit messy is better than not offering the support. That's my personal opinion.
We were just talking on the side in relation to this. It might even be an opportunity where it's not going to be a blanketed thing for all of us since we're in different states, but depending upon your location and your managers, maybe it's part of what you pay for as far as part of their health benefit packages, so that then they are stronger people to lead the people that we're asking them to lead underneath of them. So again, just another idea on that whole.
Yeah, that's a great point. Oh, I think another thing you can do, and this goes to the sexual harassment piece, it goes to the mental health piece, is what resources are you giving your managers? It's a great point. You know, you may not be able to get involved in all of your employees' personal lives, but if you can tell a manager what to do if an employee comes to them with an issue, like that in itself can make a huge difference in someone's life. So, and we deal with all things in restaurants, right? I always like to say, like, all parts of human life happen in restaurants, so we really have to be prepared to deal with things like mental health, like death, you know, like these things that we don't think about, but who are you as a business owner going to turn to if you have something catastrophic happen? You know, it's important to have, to just know what your outside resources are and kind of educate yourself about where you can direct your employees to go if they need help.
As I'm walking, can I ask a question?
Yes.
Could it be a solution to hire somebody like for your collective workforce who comes in once a week, twice a month for like open office hours, and they're like the staff therapist, so whoever wants to go see them can?
Yeah, absolutely. I love that suggestion.
I love that suggestion too, as long as there's like boundaries around that, because some people have like privacy, you know, issues around that. I wanted to give a couple resources for some of the questions that were asked. So for sexual harassment training, I know that safebars.org is a really good option. For an EAP, another good one is LifeWorks. They're owned by Morneau Chappelle, but they offer extensive mental health coverage. And the other resource I wanted to share as well was around, or the question around therapy and counseling, industry specific. So that was asked earlier. I don't know of one, but I did remember another resource that is low-cost therapy. Openpathcollective.org offers low-cost therapy throughout the country. So depending on where you live, you can just put in your zip code, and you know, if you can't offer benefits, the last thing I wanted to offer was, and you mentioned it earlier, was just reminding to personalize the benefits to what your team needs. Because I think that's such a great point earlier, that like one blanket solution is not realistic. So whatever it is that your team specifically needs in terms of resources, that maybe there could be like a stipend, right, per employee, and they get to you're empowering them to choose for themselves whatever help they want. So that was it.
Yeah.
I thought you said whatever hell they want.
Last question, if we don't mind.
Yeah.
Actually, yeah, thank you. About what you said just now, there are like some chefs in Italy that are already doing this. They have like some kind of mentor or psychologist that goes into the restaurant, but they are like very, very few because it's very expensive and it's, you know, something else that the employer has to do. One of the things that we did, I'm president and founder of a national association, and a couple of years ago, after, I don't even know, there are several people that unfortunately committed suicide, so I contacted the order psychologist, and we created a scientific study on the factors of stress in the restaurant business, which I had not done before, maybe 20 years ago, and in the United States, but long, long time ago, so totally anachronistic. And what happens is that we did a poll, they did a study and so on, and they came up with results. But one of them, all the results, they came up with a best practices booklet that is actually released to everybody, not only my association, to everyone. And so I think that the first and probably only responsibility of the employer, because we cannot really load ourselves up with all kinds of responsibilities, even to take care of mental situations that happen in our employees' life, is to be very attentive and understand exactly when there's a problem. And that's where the best practices booklet comes helpful, because you do understand by certain behavior that there might be a problem, one. And the other responsibility that we have is to make sure that there's a good work private life balance, and that you give through time off or whatever, like some of the things that I did in my restaurant, but many others did after the pandemic.
Yeah, thank you. That's great.
That was excellent, wasn't it? Thank you very much, Sarah. Shall we give
Thank
Sarah
you.
a round of applause?